So in terms of advice, guidance to really help people, what advice would you give to any business or line manager who would like to support an employee with a cancer diagnosis?
Yeah, so it builds on what we've just been talking about. So there's a few key things that I would say. Number one, be employee-led as far as you can.
Yeah.
Now, I am realistic, and I know that not every business has the level of flexibility or the capability to be as flexible as my workplace has been. But think about what your limits are and then have a discussion with the employee. Talk to the person and be led by them. As I said, some people will want to go off on sick leave the minute they're diagnosed, and then maybe don't come back until well beyond the end of treatment. Other people will want to do even more work and will throw themselves into work, and actually that's an outlet for them. So the last thing you would want to do as a people manager is to say, well, I think you should do this, or you shouldn't be at work, you should be at home resting, or whatever it is. I think you have to be led by the employee. And that kind of leads on to the second point, which is just keep talking. And regardless of cancer, my approach with work has always been to focus on relationships first. When you've got a good relationship with someone at work, in whatever context, in whatever situation, that allows you to have a better experience and actually greater results at the end of it.
Totally.
And this is a really good example again. So just keep talking. If you haven't already got a strong relationship with the person that you're managing that's got a cancer diagnosis, you can start now. Ask them questions, ask them what's important to them. Don't be scared about saying the word cancer. Don't be scared about asking how they're feeling about it. Some people might feel completely fine and I'm just going to get on with the treatment and then I'll be absolutely fine. Other people might be terrified of dying, but regardless, asking the question shows that you care and builds that relationship. And I think from a business point of view, what you get in return is you get loyalty, you get flexibility back, and you get that kind of discretionary effort that we can't measure, that we don't always know is happening. But it certainly is a two-way street in terms of the benefits of doing that. Awesome. And then the final thing that I would say would be about the end of cancer treatment. Because this has been a huge learning for me. So working in HR for over 20 years and lots of people who have sadly had similar diagnosis to me. And I fell into the trap of assuming that once the employee came back to work or once the kind of active cancer treatment was over, they've had their chemo, they've had the radiotherapy, they've had the surgery, whatever, then it's kind of back to normal. And the reality couldn't be further from the truth. Totally. And a lot of what I'm trying to do now is to help people understand that actually I'm kind of 7-8 months beyond chemo, and yet chemo still has an impact on my physical capabilities. I'm now going through a medically induced menopause. That's having an impact on my mental health, my cognitive ability, my physical health. I still am under the care of, I don't know, at the last count, probably 6 or 7 professionals, medical professionals. I'm going for scans, I'm going for checkups, I've still got infusions, I've still got doctor's visits, all sorts of things still going. And that's me cancer-free and at the end of my treatment. So that's the final bit of advice I guess I would give to a business or a line manager, is find out. It will be different for your employees. Find out what it's like for them now at the end of it all. Don't assume that they're just going to be back to normal. Cancer challenges your very identity. So work with that person to say, okay, I understand, it's great, it's fantastic, celebrate that you've finished chemo, great, but actually what's still going on, and that can be really challenging for people.
Totally. I'm interested actually to pick your brains, because you touched on a point there that I thought that's really relevant, and I think there will be people that think, so you talked about how you were fortunate in that you had a really good employer. You had a really good manager who let you lead. It was employee led. You don't need me to tell you, Tara, there are lots of companies out there that are not led by their employee voice. And there will be people there that are facing a diagnosis like this who possibly don't have a good relationship. And it's maybe not even as far as saying they don't have a good relationship, but they just don't feel comfortable. They don't know how to approach it. Do you have any tips that you could maybe give those individuals if they are in that position about how to even start that conversation? I heard what you said loud and clear, you know, start working in that relationship. But if you're in that moment there, been told you have cancer, you've been given your treatment plan, you know it's going to impact not just yourself and your friends and your family, but your work. Would you recommend that they maybe give leaflets to their manager? What's out there?
Yeah.
What tools are out there for them?
Yeah, I think for that individual diagnosis time, there is so much going on, and it's very each situation will be different, and your preferences as an individual will be different. But if you're wanting to have a conversation with your line manager and you're just not sure how, then I think sometimes it could be putting something in, I say in writing, not to be formal, but just to give them a bit of a heads up. So maybe drop them a note and just say, either I've had some really difficult news, this is what's happening, or I want to talk to you about something and I want to make sure that we've got that time to talk. So giving them a bit of a flag to say this is a really important conversation. The other thing would be so I'm always really hesitant about go and speak to HR. Being in HR myself, I always recommend that the best relationship to work on is between the employee and the line manager. That said, if there is HR, if there are mental health first aiders, if there's an occupational health function, or even if there's just a trusted colleague that you feel comfortable talking to and asking for their support, maybe asking for them to come with you to a meeting with your manager, use the support around you. And then external to business. So Maggie's charities actually run a cancer in the workplace workshop that I would recommend anyone go to. There's also Cancer Support UK, who gives support to kind of workplace cancer ambassadors. And there is a huge amount online as well. So if you were to go, particularly specific cancers, now obviously breast cancer is an incredibly common cancer, which is not great, but it's great in that it has a huge amount of resources and a lot of kind of preparation. So things like Macmillan, Maggie's, Breast Cancer Now, I would imagine they would all have information for businesses on how to deal with their employees. And also for the cancer patient themselves to talk to work.
No, that's really helpful. It's just because, you know, I'm so delighted that has been your experience, but equally we all know people that, you know, don't have that experience. So that's been super helpful. Tara, I cannot thank you enough. I'm just delighted that you were happy to share your story, and it's so lovely to see you coming through the other side. And as you say, you've still got a journey ahead of you, but you know, I have no doubt with your attitude and determination and everything else that's going in your favor that you will continue to thrive. So I can only wish you continued health and success. And I'm delighted to see that you're back in work today. That is good. And long may that continue. So thank you again, Tara.
Oh, thank you so much, Katie. And yeah, I think you're right. If this helps one person, if this helps a couple of people, that's all I want to do. So thank you for giving me the opportunity.
No, my pleasure.